is going to tell us about this effect. Thank you. I would like to congratulate because today, 14th of March, is the medical day. Phosphodiesterase type 5 inhibitors, and the approach to erectile dysfunction mechanisms, pharmacologic interaction, and our clinical and practical implementation. And there are a few things, as you all know, and I will be repeating them once again. Erectile dysfunction, if we define that, erectile dysfunction means that for a male in a repeated form, when the male is unable to reach penile erection and to sustain it, for erectile dysfunction for many years have come to be accepted as a normal part of aging and the psychological dysfunction. So it has been sort of overlooked. Perhaps we did not have the satisfactory material. And this sort of reflected on the state and establishments throughout the world. Many countries came to accept that this is a normal trend. So reimbursement by social security organizations were not accepting this treatment. Erectile dysfunction, we all know that has a psychological base. Anxiety, depression, especially in those cases, erectile dysfunction can develop. But in general, erectile dysfunction also has an organic base as well. Usually cardiovascular and other cerebrovascular organic incidences appear because they have relations with each other: hypertension, peripheral vascular diseases, and general risk factors, perennial disease, and pelvis fractures, antihypertensives, antidepressants, and some radiological treatments like radiotherapy give rise to this dysfunction. Smoking, for example, alcohol, drug abuse, all have an influence and play an important role in erectile dysfunction. Why is erectile dysfunction important? Because it's a pre-indication, a warning of many diseases: diabetes, hypertension, hypercholesterolemia, and depression and anxiety. Many such diseases first exhibit itself with erectile dysfunction. We have a study, Maliev study, for example, and in a big sample group, erectile function and dysfunction are compared: hypertension, dyslipidemia, cardiovascular diseases, diabetes, depression, anxiety. Many ailments existed, and that it was quite high compared to those that do not have an erectile dysfunction. Erectile dysfunction, although at the start it was accepted as a psychological appearance, but in the later process it loses self-confidence, creates depression, anxiety, and problems in the family and relations between a spouse and the other gender, and we confront it as a serious psychological problem. What is the frequency? And in fitting with our classical information, between the age of 40 to 70, erectile dysfunction increases. In the Massachusetts study in 94, in 40 years to 70 years between males, about more than half of the cases have light to severe levels of erectile dysfunction. And if during life, and since lifespan survival is increasing, considering development other risk factors, in 2025 about 320 million males will be facing erectile dysfunction and will need treatment. We have a study carried out in this country as well in 2002, where the rate in our country is much higher, around 70%. But in our country, light erectile dysfunction, according to this study, is slightly at a higher rate as well. The process of erection, how will it develop? Considering the mechanism, I would like to give you some information. For erectile dysfunction, for the erection process, a stimulus, a sexual stimulus is necessary. And that's a process, this causes penile erection. The mechanism, when we look into the mechanism, usually, first of all, sexual stimulation is important. From the endothelial cell of corpus cavernum, oxygen and arginine come together and create nitric oxide. In corpus cavernosum is secreted into the synaptic intervals, and cyclical granule monophosphate appears. And after this process, cyclic guanyl phosphate is an important stage, because after that phosphodiesterase 5 inhibitor cannot be inhibited. Later on, protein kinase that is particular to itself is induced, and following that, inside the cell, reduction of the oxygen level and relaxation of the smooth muscles, and erection appears. Granule monophosphatase destruction is created by phosphodiesterase 5 inhibitors. And if these phosphodiesterase 5 inhibitors are inhibited, this mechanism appears. The historical trend, and then we consider the trend way back in 1920s. John Brinkley was an individual that first started this, and he had animal testes, and he had the injections into the males, but patients died off. Some of these patients died off, and he was penalized for that. And later then, from natural various interventions to vacuum treatment, and we came to the 1970s. In the 1970s, vacuums were used because it was classified as a psychological problem. And 1973, inflatable prostheses were used. In 1980, intercorporal injections, alprostadil, was marketed. In the 90s, giglobiloba, herbal extracts were used for treatment, and in 1998 sildenafil, Viagra, came up, and this was a product that was anti-anginal, but in some cases it was observed it resulted in erection. It was discovered, and later all in 2000, what is called Uprima, amomorphin, is another erection drug that was marketed, and phosphodiesterase 5 inhibitors. Two others are present in the market. WHO, in the treatment of erectile dysfunction, first of all, consultancy was important, and to improving the risk factors that can be changed, like alcohol intake, smoking, or some bodily physical aspect that could be overcome. Later on, oral agents are first-line agents if it is not contraindicated. Otherwise, intracavernous injections, vacuum equipments, prostaglandin A1, intraureteral administration, and if not, that is not possible, prostheses can be resorted to. And phosphodiesterase in oral treatment is mentioned in many guidelines. And we have three basic drugs, Viagra, Levitra, Cialis, and others, apomorphine, and also other phosphodiesterase inhibitors also exist in our country. And also sildenafil and vardenafil show similar characteristics. Both of them, besides phosphodiesterase 5 inhibitors, inhibit other phosphodiesterases as well. But it inhibits especially 6 inhibitor. In PDE5, we have materials that are present in the retina, and their inhibition, as we see in these drugs, can have the increasing effect of a visual effect. Tadalafil, for example, phosphodiesterase A11 is where it has an inhibiting effect, but its efficacy mechanism is not well known. But all three drugs are effective, safe, dependable, well tolerated, but the warning is that these drugs should be used once a day. Otherwise, it has some hypotensive and other more dramatic side effects that become evident. As I have explained, cyclic guanine monophosphate is owned. It's important in the erection. Phosphodiesterase 5 inhibitors are effective, and this is an important mechanism. When for PDE5 inhibitors, the pharmacokinetic characteristics, maximum plasma concentration length for sildenafil, vardenafil, it's for 1 hour. For tadalafil, it's 2 hours. Plasma half-life, sildenafil, vardenafil 4, for tadalafil, 17 hours, and it can show why tadalafil can be effective for more than 30 hours. Another pharmacokinetic characteristic that it is used with fatty food. And usually it is indicated there is no difference in using these drugs fasting on a full stomach, but especially sildenafil and vardenafil, if taken with fatty foods, efficacy reduces. Viagra, 29%, in vardenafil, 20% reduction is recognized. And when taken in with fatty food, the activity is delayed for 1 hour. Tadalafil is not influenced. For hepatic metabolites, we see automatically the drugs are working as expected. In all three PDE5s, there is no interaction with alcohol. It does not increase the hypotensive effects or have an interaction with alcohol. But we should not forget that alcohol also causes erectile dysfunction. Although it's not a contraindication, it should not be used or advised to be used with these drugs. Usually it starts in 30 to 60 minutes. No drug has an immediate effect. When you read the prospectus, it's 60 minutes in sildenafil, vardenafil about 30 to 6, tadalafil 30 to 60 minutes. But still, clinical studies have indicated that sildenafil starts activity in 14 minutes, vardenafil early is 10 minutes, and that tadalafil in 15 minutes. Usually, the tadalafil is active up to 36 hours because of its long half-life compared to the other two drugs. But the clinic experience shows us sildenafil and vardenafil is also able to keep erection for 8 to 10 hours as well. Well, what about assessing the response? We should not forget the fact that the pharmacokinetic interaction and the use with other drugs should be considered. If the appropriate treatment is exhibited, cases that do not respond can change into responding cases in a short time. As for efficacy, there are some studies. Sexual counter profile, and this is the scale that is used. In the third question, your erection has been long enough to provide you a satisfactory intercourse. With sildenafil in 329 placebo-controlled cases, 65% of the sildenafil users gave a positive answer. With tadalafil, 68% gave a positive response to 20 milligram. In vardenafil, again, 65%. So, in a serious manner, in 2/3, sexual erection or a sexual intercourse was successfully exercised. Well, what about lack of response? Usually the time of intercourse is not well regulated. and just after taking the medication can be an important reason for lack of response. And sometimes they take a single dose, and when that doesn't respond, they declare they don't respond. But the proposal is that it's a mistake not to propose to go titrate the dose. Pharmacokinetic peculiarities should be considered. For example, alcohol intake and whether there is a appropriate sexual stimulus or not, intake of food, other medication, and in order to insist that there is no response, at least it should be tried 4 times. And also as ways for overcoming lack of response, what we call fast, a good follow-up, adjustment of the time of administration, an hour before intercourse, enough sexual stimulation, titration to the maximum tolerated dose. These are important factors. And idiopathically, without any reason, not erectile dysfunction, but stable cardiovascular disease, stable diabetes, clinic depression patients, prostate surgery where the nerves are protected, phosphodiesterase 5 inhibitors have been shown to be effective in many studies. All 3 drugs can be easily and safely used with hypertensive patients with diuretics, ACE inhibitors, calcium channel blockers, and beta blockers. It can be safely used without any interaction. And what are the contraindications? There is a serious pathology. It's conjugated with nitrates because nitrates can cause hypertension. Phosphodiesterase 5 inhibitors can lead to such hypertension, so the two should not be taken together. All those studies did not indicate side effects like acute MI or death. Still, there should be care. Another warning is on alpha blockers for doxorubicin, Cardura. People that use such hypertensive drugs, these should not be used. It can give rise to serious side effects like hypertension. So the individuals that use these drugs, especially for sildenafil, 4 hours, for vardenafil and tenofovir, 6 hours prior to this, and if intake of the other hypertensive drug, a lapse of such interval should be realized, or the type of drug, hypertensive drug, should be changed. Well, what are the cases, severe cases, where it should be used with care? Unstable angina pectoris, uncontrolled hypertension, congestive heart failure, grade 3 or 4, shorter duration of 2 weeks of MI history, high arrhythmia risk, obstructive hypertrophic cardiomyopathy. These cases indicate warning. Well, what about side effects? For phosphodiesterase 5 enzyme, where these enzymes exist, besides the corpus cavernosum, they are present in various bodily organs and blood vessels. So, related to their vasodilatation, certain side effects can exist. Headache, for example, 15% headache in all 3 drugs. Flushing, besides that. Rhinitis, similar to flu. Nasal congestion, sinusitis, diarrhea. These indications can appear because of vasodilatation. And also visual acuity is sometimes influenced in sildenafil and vardenafil, and that it is related to phosphodiesterase 6. Tadalafil, as different from the other drugs, can create myalgia or backache, lower backache, but it is such a high extent of backache and myalgia has not been encountered. And anterior ischemic neuropathy, and also a picture that leads to deficit in visual acuity, and it's usually related to cardiac risk factors. Phosphodiesterase 5 inhibitors, and 38 cases And one case with tadalafil has been indicated. And if in these cases there is any distortion in visuality, the drug should be terminated and a consultation should be demanded. And this can be unilateral. Individuals that has the same experience on the other eye as well should not use these drugs. What do the patients prefer? And they usually prefer oral therapy. They don't like invasive interventions. And the studies have shown that the drugs that have a longer half-life, tadalafil for example, 70% prefer that and 30% prefer sildenafil. And in the longer term, it does improve the quality of life. In conclusion, erectile dysfunction is an important part of our daily life, can be effective, and it could be a heralder of other diseases. And while laying down the choice of treatment, besides the individual's choice, we should consider the interaction with other drugs and food. But it is well tolerated. And while starting this treatment, it should be stated that sexual stimulus is necessary, and before declaring lack of response to the drug, it should be tried at least 4 times, and the dose can be titrated. Vardenafil, for example, you start with 10 milligrams, go up to 20 milligrams, or go down to 5 milligrams, depending on the case. As I expressed a little while there, in Viagra and Vardenafil, absorption is reduced when it accompanies fatty food, and also testosterone support needs to be provided, and all side effects should be clearly exhibited. PDE5 inhibitors in the treatment of erectile dysfunction has been an important milestone that has provided us with options like in pulmonary hypertension. They have use in other fields as well. But the proper use of these drugs improves the quality of life of our patients to a good